with me today, Chuck. Before we get started, why don't you review with me a little bit about your experiences with Medicare and what you'd like to get out of our conversation today?
Well, I've had Medicare for years and have been continually confused by the way information is provided. It's hard to understand what my options are. So I've tried a number of ways to figure out what will work best for my wife and myself. I read the Medicare literature that the government sent, but I still needed more information. So I called the 1-800-MEDICARE number and sat on hold for a very long time. And when I finally talked to a person, she didn't understand my question and kept passing me to other areas. Needless to say, I got frustrated and decided to hang up. Then I went on the Medicare website, and that was way too confusing. So I called an insurance agent. He signed me up for a plan that is costing me a lot of money, and I don't understand why. I don't like this plan and I want to change, but I'm not sure what to look for in a new plan. There seem to be secret terms that I need to know in order to get the information and coverage I want. That's what I'm hoping to get out of our conversation today.
Wow. Well, thank you for sharing that with me. Many people with Medicare have told me about similar situations and feelings because Medicare can be very, very difficult to understand. Right now, there are about 46 million people on Medicare, and all of them need to get information to make the right decisions about their health care. And 46 million is a lot of people. And sometimes the demand for Medicare educational services overwhelm the resources that are out there. But in your case, what I'd like to do in order to help you and your wife find the best coverage, here's what we're going to talk about. Number one, the coverage that you have currently through the federal government that's called Original Medicare. Because all other coverage options that you would consider are all based and designed around those benefits. Number two, we're going to outline your plan options and how they either work with Original Medicare or replace it. And then finally, we're going to talk about some important points that people consider when they're choosing between these different options. Once you understand those issues and how each type of coverage addresses them, then you'll be much better prepared to talk to a licensed agent who can enroll you in that kind of plan. Does that pretty much cover what you want to know about?
Yep, it sounds great.
Good, good. Now, before we get started, please understand that our conversation is strictly educational. I'm not a sales rep, and I'm not a medical professional. So before you change any medical treatment plans or your lifestyle, talk to your doctor, and then talk to a licensed agent in order to make a change in your health care plan. Okay? Does that make sense?
Absolutely.
Let's take a look at a presentation that can explain a lot of the secret terms, as you called it, in simple language. And here's the cruxes of the matter, Chuck. When you're looking at Medicare, all right, there's essentially two big options that are available to you. I had said to you earlier that when you turn 65, or some people become eligible for Medicare through disability, you get certain parts, as it's called, from the federal government. I don't know if you remember this. You get Part A, and we'll be talking about that in detail in a second. Then you get Part B. So if you see on the left, there's 4 puzzle pieces. You see that?
Yes.
There are plans that work in conjunction with and supplement the benefits that you get from the federal government, okay?
And nobody is watching out for you, I guess, right? I mean, when you get that bill, there's nobody else. It's the people billing you, and there's you, and if you aren't going to argue about it, that's it, I guess.
Absolutely. And a lot of people on Medicare don't understand the billing well enough to challenge it. And not only that, you get these sweet ladies, who are living alone, their kids and, husband, or, So, anyway.
We had one hospital experience last year. My wife was in the hospital for a period of time. we finally got the bill, there was an amount which sounds like it was this amount you mentioned of of the minimum or whatever for the period that she was in there.
Deductible?
Yeah, it was something under $1,000. It was a $50,000 hospitalization, and it was something under $1,000 that I was asked to pay, and I figure that was that deductible that you mentioned.